Hello, I'm Stephen Thomas. I'm a podiatrist, which is a foot and ankle specialist, and I'm based in Harley Street in central London. Athlete's foot is an extremely common skin infection of the foot and can affect up to about 70% of people during their lifetime. If you have scaly, dry skin or itchiness on your feet, you may well have athlete's foot. If this is you, keep watching or forward the video on to somebody who needs it. In this video, I'm going to tell you what athlete's foot is, how it typically presents, how you prevent from contracting it, and how to treat it. I'm also going to share with you some of my special tips to help you destroy this thing in the fastest time possible. There's also some links to further information and to some products that might help you in the description below. So that's the introduction. Let's get to what is athlete's foot. So athlete's foot is medically known as Tinea pedis, and it's effectively a fungal infection of the skin on the feet. It affects up to about 70% of people during their lifetime, and the three main fungi that cause this infection are displayed on the screen right now. You'll pick this athlete's foot infection up on contaminated grounds by going barefoot, usually in high traffic areas, such as gyms and changing rooms. It's most common amongst the elderly, but also within people of certain occupations. These occupations typically involve athletes, hence where the names come from, but also chefs, miners, and soldiers. These types of professions tend to get more affected because they involve lots of increased friction on the feet and wearing shoes that allow humidity and temperatures to increase. A diagnosis is usually possible on clinical presentation, but in some cases, skin scrapings can be taken and sent to the lab for PCR testing. Now that we've discussed about athlete's foot, let's discuss the typical presentation. The most common place to develop athlete's foot is between the toes, particularly in between the fifth webbing space, but it's also possible to infect underneath the foot and around the heel edges. Between the toes are the most common area because these areas stay sweaty for a longer period of time and a lot more difficult areas to dry out. Typically, you might see some peeling or flaking of the skin in sort of a dry, scaly pattern. These areas can also become itchy, causing you to scratch them, which spreads the infection even further. Some people that have athlete's foot will notice the dry scaliness and think it's just dry skin. So they'll put moisturizer on it, which will just improve the symptoms over a short period of time. But then symptoms will return and often worsen. Now that we've gone through about athlete's foot, how it typically presents, let's get to how you prevent developing it. To avoid developing athlete's foot, you'll want to avoid going barefoot in high traffic areas such as gyms, changing rooms and showers. These areas you'll want to wear sandals or flip-flops if possible. Dry between the toes thoroughly after your showers and before you put the socks on. Use well-ventilated shoes to keep the humidity and the temperature down. Use natural fibre socks such as cotton or bamboo to help absorb as much moisture as you can. Now that we've gone through how to prevent athlete's foot, let's get to the treatments and then my special tips to help you destroy this in the fastest time possible. But before we do, remember to give this video a thumbs up if you enjoy it. You can subscribe to the channel, and if you have any questions on athlete's foot, pop them in the comments below. I'll get back to you, and I might even make a video on your question so that we can help many other people. So athlete's foot treatments. There are three main areas we need to remember to treat for athlete's foot. You want to treat the skin, your shoes, and your socks. Wash your feet and use Antifungal Cream daily, concentrating between the toes, under the foot, and the heel edges. Use well-ventilated shoes to keep the humidity and the temperature down, and make sure your shoes thoroughly dry out between uses. Wash your natural fibre socks at 60 degrees or higher, and this will help kill the fungus in your socks. File down any hard skin or see your local podiatrist that can help shave this right down, particularly if it's very thick. Use antifungal spray inside your shoes every day. Oral antifungal tablets are available if you're not seeing any results from all the other treatments. And finally, here are my best tips. Now remember to treat the 3 areas: the foot, the shoes, and your socks. You have to remember, if you have fungal infection on your skin, it is for sure inside your socks and your shoes. So even if you completely eradicate it from your skin, it's usually just a matter of time before it migrates back onto your feet. The packs of the antifungal creams say to use it once a day for 1 week. However, in my clinical practice, I noticed that patients tend to do better if they use it for at least 2 weeks. Bear in mind that skin cell turnover is about 1 month, so this is the amount of time it takes for all the skin cells to regenerate. So you'll need to expect to keep up treatments for about 1 month, and don't lose hope if you're not seeing any results within the first few days or a week. It may take at least 10 days before you start to notice any visible improvements. If you have athlete's foot, treat it as fast as you can. You can risk spreading the infection to across the whole foot, but more importantly, it can travel up to your toenails and then migrate onto your toenails. Fungal infection of the nail is a lot more trickier to treat than the skin. If you are struggling with athlete's foot, despite all these treatments, see your local podiatrist, your GP, or your dermatologist who can help you. I hope that video was useful. Please remember to like, subscribe, and pop any comments you have down below, and I will see you soon. Thank you.